नेशनल कॉलेज ऑफ चेस्ट फिजिशियन यूपी चैप्टर द्वारा इंडियन मेडिकल एसोसिएशन कानपुर शाखा के सहयोग से थोरेकोविजन 2025 सीएमई-कम वर्कशॉप ऑन मेडिकल थोरेकोस्कोपी का आयोजन आईएमए भवन कानपुर में किया गया। इस शैक्षणिक कार्यक्रम में देश भर से आए प्रसिद्ध विशेषज्ञों और पल्मोनरी मेडिसिन के शिक्षकों ने भाग लिया। कार्यक्रम ने शिक्षण, संवाद और व्यावहारिक अनुभव का एक उत्कृष्ट मंच प्रदान किया। थोरकोविजन 2025 featured a series of comprehensive scientific sessions, live demonstrations, and practical training on models and mannequins. Participants gained valuable insights into the principles, techniques, and recent advancements in the field of medical thoracoscopy. आयोजकों ने बताया कि यह कार्यक्रम अत्यंत उपयोगी और प्रेरणादायक रहा, जिसने प्रतिभागियों में शैक्षणिक उत्कृष्टता, कौशल विकास और आपसी सहयोग की भावना को प्रोत्साहित किया। सीएमई-कम वर्कशॉप का समापन उत्साहपूर्ण वातावरण में हुआ, जिसमें देश भर से आए प्रतिभागियों, फैकल्टी मेंबर्स और चिकित्सकों ने सक्रिय भागीदारी की। यह आयोजन कानपुर में चिकित्सा शिक्षा के क्षेत्र में एक महत्वपूर्ण उपलब्धि के रूप में दर्ज हुआ।
आदरणीय गुरुजन, सभागार में उपस्थित हमारे वरिष्ठगण, गुरु सखा जितने भी सहपाठी आए हुए हैं, साथियों, आप सबका आज के इस विशेष कार्यक्रम में स्वागत है। कार्यक्रम विशेष इसलिए है कि इस कार्यक्रम की जो रूपरेखा, धुरी, कार्य संचालन, संपादन, सब कुछ करने वाले जिस व्यक्तित्व का हाथ है, जिस व्यक्ति का हाथ है, उन्होंने अपने इस वर्ष अपने जीवन के 50 वर्ष शिक्षण क्षेत्र में, शिक्षण यात्रा में पूरे कर लिए हैं। सर, केवल ताली से नहीं है कि स्टैंड अप ओवेशन होता है सर, क्योंकि सर प्लीज, थैंक यू सर, क्योंकि न कागज, न कलम, न किसी किताब से सीखा है, हमने जिंदगी जीने का हुनर आपसे सीखा है सर। तो सर, हम लोग जो हैं वादा करते हैं बहुत थोड़ा बोलेंगे, लेकिन ये वादा ही है, निभाना जरूरी नहीं है। हमारे सहपाठी बहुत ही अभिन्न मित्र हैं, देहरादून से आए हुए हैं। अब ये आगे का कार्यक्रम ये भी देखेंगे, हम भी देखते रहेंगे, लेकिन ये जब बोलें तो आप लोग गूगल खोल लीजिएगा। ये हमारे चिकित्सा जगत के शशि थरूर हैं, थोड़ा अंग्रेजी में दिक्कत आएगी।
Thank you, Dr. Chan, for your kind words. Honorable Professor Katiyar sir, distinguished teachers, President IMA Kanpur, Dr. Mehrotra, distinguished delegates, ladies and gentlemen. On behalf of the organizing committee, it's an honor to welcome you all to this Thoracovision 2025. Friends, success cannot be pursued, success ensues. It flows as an intentional byproduct of efforts concentrated in the direction of worthy cause. This ethos is reflected in the lives of our illustrious guests and faculty and the great institutions they represent. Friends, larger the island of knowledge, the longer the shoreline of wonder. While I am convinced that the scientific sessions will challenge us to change and adopt the best in practice, I wish to acknowledge the courage of our patients in dealing with these conditions and to recognize them for their inspiration and motivation they provide to develop newer and effective therapies. I hope some piece of what you listen and imbibe will provide the nudge you may be seeking to advance further in your professional lives. With these words, we welcome you once again. Friends, it's time for the lamp lighting. संस्कृति हमारे जीवन का एक अभिन्न अंग है। मानव ने अत्यंत प्राचीन काल से सभ्यता को अपनाया और यही सभ्यता उसके जीवन में एक रूप हो गई। हमारे जीवन में दीप जलाकर किसी भी कार्य को प्रारंभ करने की से पहले हम दीप प्रज्वलित करते हैं और यही हमारी संस्कृति की देन है। अब मैं आमंत्रित करूंगा माननीय प्रोफेसर कटियार सर, डॉक्टर मेहरोत्रा सर और तमाम फैकल्टी हमारे जो बाहर से आए हुए हैं, तो कृपया डायस पे आए और दीप प्रज्वलन करें।
एक लोग इधर आइए प्लीज, एक लोग जल्दी से इधर आइए। एक सेकंड, जस्ट
The metaphor of light is often used to describe the spiritual realities. Buddha on his deathbed advised, become a light unto yourself. We are all Buddhas, but densely clouded.
First of all, I would like to welcome all the delegates, our eminent speakers, and our patron and organizer, Dr. S.K. Katiyar sir, who has been our eminent professor, principal and dean, and a renowned chest specialist of Kanpur. People all over UP and India have been coming to him just to take opinion. We are very, very proud of Dr. S.K. Katiyar sir, and it is a privilege being here, and I think it is a privilege being among all of you and welcoming all of you. In ancient days, there used to be one guru and a lot of shishya, like Dronachar, and shishya like a club used to be there, who used to offer Guru Dakshina also. But in modern era, we have many gurus who are highly qualified and they provide knowledge to all the young comers, all the young people who seek knowledge. This is a profession where every individual needs a guru, and that is the main cause, main reason why all the people come up with so much of knowledge. And with this, I invite all the delegates who have already had a workshop, and they will be entertained with lot of knowledge coming up. Thank you all.
Thank you, sir. Well, friends, it's an honor to invite Professor Katiyar, but before that, it's still an honor for me to be a student and to be standing here. After so many years, I'm speaking something for him. I remember as a junior resident, I had the opportunity to be the master of ceremonies when Sir was the IMA president, and there was an annual function, and I had been the master of ceremonies of that program too. This happened in the GSVM college way back in 1997. So 30 years down the line, I'm standing here in front of you all again, and it's really an honor and privilege, sir. Friends, nowadays we think of a philanthropist as someone who donates big sum of money, yet the word has been derived from the two Greek words, philos, loving, and anthropod, man, a loving man. No one can match the capabilities of our profession when it comes to living this word. Charity doesn't require a large deed. It often takes just an act of kindness in the form of warm smile or a kind word to transform the sick and ailing souls from despair to hope. Money and machine may change the face of medicine, but the true ethos and reflection of success will always side with an empathetic professional. Remember, the greatest gift we give to our patient is the purity of attention and the trust of our consciousness. This was the ethos of this great legend, Professor S.K. Katiyar. Sir, you are the fountainhead of knowledge. The rich harvest of Murarians is the mark of testimony to your efforts in moldering, mentoring, and inspiring generations of criminologists, and wishing you so many more milestones, sir. With these words, I welcome you to please give your welcome address.
अभी तो सर ने गोल्डन जुबली का ही प्रोग्राम बनाया, अभी तो डायमंड और प्लेटिनम के लिए भी हम लोग को तैयार रहना है सर।
Thank you, dear, for the nice words about me, both of you. President of Indian Medical Association, Kanpur branch, Dr. Anurag Malhotra, distinguished faculty members, distinguished colleagues, and young friends. It gives me immense pleasure to welcome you all to Thoracovision 2025, organized under the banner of National College Association's UP branch, in association with the Indian Medical Association Kanpur branch. As the organizing chairman and as the chairman of the scientific committee and academic forum of National College Association India and its central zone, I feel truly honored to host this premier academic event at Kanpur. Albert Einstein said, education is not the learning of facts, but the training of the mind to think. Today, we have amongst us bright postgraduates from different medical colleges in the state, students who are pursuing pulmonary medicine and course in allied specialties from various medical colleges. Your presence reflects your commitment to learning, skill building, and advancing the future of respiratory care in our country. I warmly welcome each one of you for being here with us for this workshop and training program. This program has been meticulously designed to blend knowledge, skill, and real-time practice. Over the next sessions, you will experience lectures by eminent faculty from across India, interactive discussions with leading experts in thoracoscopy, and you already had a live hands-on training on the models and mannequins before this afternoon session. Benjamin Franklin said, "Tell me and I forget, teach me and I may remember, involve me and I learn." So we are also privileged to have distinguished faculty members who have traveled long distances to share their experience, their expertise with us. I extend my heartfelt gratitude to each of them for enriching this academic endeavor and their wisdom, experience, and dedication. This medical teaching program, Thoracovision 2025, holds special significance for me personally, as it also marks 50 years of my academic journey. To have some of my brilliant students, now respected leaders and holding key positions across the country, come together today is a moment of immense pride and emotion for me. I am deeply touched and truly overwhelmed by your affection and presence here this afternoon. A teacher's success lies not in personal achievements, but in the accomplishments of their students. I also extend my sincere thanks to the Indian Medical Association for joining hands with us in organizing this meaningful event. Their partnership enhances our mission and ensures that not only postgraduate students but also practicing physicians benefit from the latest scientific knowledge, ultimately improving patient care and strengthening the society. When we share knowledge, we multiply it. When we apply knowledge, we transform lives. Friends, this program is not merely an academic gathering. It is a celebration of learning, mentorship, and service to humanity. We remain committed to bringing many more such high-quality academic endeavors in the future for the advancement of specialty and for the better patient care. Once again, I warmly welcome you all to Thoracovision 2025 and wish you an enriching, inspiring and memorable learning experience. Thank you very much.
Dr. Mathur.
सर आप इधर
सब बीच में
And last, myself, Dr. Sudhanshu. Sir?
चौहान सर
Sorry if I missed any name, Dr. Sushil Jain.
कुछ लोग हम लोग बैठ सकते हैं, नीचे आ जाए क्या? जिनके नाम
If any name I missed, you
Sir,
are the Buranian and the Pateli, please come up.
चौहान सर आ जाइए, जो लोग आ सकते हैं उस तरफ आ जाइए।
कुछ लोग हम लोग बैठ जाते हैं तो सबसे बढ़िया रहेगा।
आ जाइए, आगे आ जाइए, कुछ छोटे लोग पीछे हैं, आ जाइए आगे।
ठीक।
यस सर, रेडी।
गुरुजी ने किताबी ज्ञान तो हम लोगों को दिया ही दिया, आजकल व्यवहारिक ज्ञान भी हम लोगों को देते हैं मुरारियन ग्रुप में। वो प्रतिदिन वो कुछ ना कुछ आता रहता है, बहुत कुछ सिखाया जिंदगी के सफर में अनजाने में, वो किताबों में दर्ज था ही नहीं जो सबक सिखाया जमाने में। तो आजकल गुरुजी वो भी सिखाते रहते हैं हम लोगों को, बहुत बढ़िया, और हमेशा साथ रहता है उनका। ये हम लोगों के लिए बड़े ही आशीर्वाद की बात है, हर समय बहुत जरूरी है कि तपस्या तपी ने ज्ञान का सागर मिला है, जो निरंतर बह रही सरिता उसे सागर मिला है। हमारे गुरु जी को जो है हम लोग ईश्वर से प्रार्थना करते हैं वो ना केवल दीर्घायु हो बल्कि चिरायु भी रहें, ताकि जो है हमें सदैव जो है हम लोगों को प्रेरणा देते रहें। और इसीलिए मैंने कहा कि डायमंड और अभी प्लैटिनम में भी जो है शिक्षा का साथ देते रहेंगे सर हमारे साथ हम लोग। तो पूरी धरा भी साथ दे तो और बात है, तू जरा भी साथ दे तो और बात है। यूं तो एक पैर से भी चलते हैं लोग, पर दूसरा भी साथ दे तो और बात है। तो सर स्वागत है। अब आज के कार्यशाला में हम लोग चलते हैं। कार्यशाला जो है ये फेफड़े पे है, सभी को पता है, और इस फेफड़े के लिए जो है सबसे प्रथम जो आता है वो ये आता है कि किसी भी युद्ध क्षेत्र में घुसने से पहले, अभी जैसे संदीप अंदर घुसेंगे प्लूरा में, है ना, कोई ब्रांकोस्कोपी से घुस जाएगा, तो कहीं भी घुसने से पहले, किसी भी युद्ध क्षेत्र में घुसने से पहले युद्ध क्षेत्र की व्यूहरचना जानना बहुत आवश्यक होता है। और इस व्यूहरचना को हमारे गोरखपुर योगी जी के यहाँ से आए हुए बुलडोजर नहीं लाए हैं, सुबोध पांडे सर आपको जो है बाकी की बताएंगे। डिकोडिंग द प्लूरल स्पेस एनाटॉमिकल बेसिस एंड क्लिनिकल पैथोफिजियोलॉजी, इसके लिए मैं आमंत्रित करता हूं डॉक्टर सुबोध पांडे सर को। आइए प्लीज।
Thank you, sir. Good afternoon to chairpersons, Professor Sudhir Chaudhary sir, respected Dr. S.K. Katiyar sir, Dr. Anand Jasal sir, lot of my seniors who taught me many lessons of life as well as my academic terminology, and where I'm here, the contribution from my teachers, from my juniors, from my seniors and my colleagues are very much important. It's my privilege and honor for me to be here rather than there. I was there for many years and given an opportunity by Katiyar sir to discuss something about I discussed the युद्ध क्षेत्र की रचना जानने के लिए जो जरूरी है, to starting the talk on the this decoding the anatomy of pleura as well as how the fusion develops.
But I would like to ask some question regarding the LHS fusion. There is a lot of confusion, especially in cases of pleural effusion, especially in cases of tuberculosis and pneumonia. And I would like to ask one basic question, basically, especially about the ADA level. There is a lot of confusion basically in cases of ADA level. The normal level is around 30 to 40 per liter, but in some cases it's very difficult, like when the protein level is higher exudative and say large lymphocytic predominance, but ADA level is around 25, 28. At that time it's very difficult to decide what is the importance of ADA in cases of diagnosis of tuberculosis and pneumonia.
So what I have learned from books and what I have practiced in these few years, what book says that ADA more than 40 is highly suggested of tuberculosis, but the interpretation of ADA, its diagnostic status to be seen as a whole in the patient scenario. Suppose somebody is young age and ADA is low and your exudate, it may be having with short history, maybe having pneumonia. But if the patient has old age, with that exudate effusion, low ADA and history long, patient having loss of appetite, weakness, that definitely we should think about the other cause may be contributing. Sometimes the pneumonia patient comes, the ADA is high, short history, significant amount of the protein is there, but what is the level of glucose? That important contributor factor, whether this effusion is because of pneumonia or this effusion, this high ADA is because of tuberculosis. In our country, tuberculosis is a very high burden. If the patient having in fact comorbidity like diabetes, then definitely we should give more value of ADA. In many cases, we see the ADA is high, connected to disorders. ADA is sometimes confusing. The patient we may need to know what is the ANA level in the effusion. In that case, the ADA value may be high, but that effusion may be because of connective tissue disorder. So the ADA level to not be interpreted in the laboratory basis, its interpretation to be based on the patient clinical condition, your other supportive measures.
Thank you, Mr. Subodh. I request Dr. Sudhir Chaudhary sir, please say something about.
Okay, the session is getting late. I would like to thank Dr. Subodh Pandey for delivering the excellent lecture. Actually, the anatomy of pleura is very important. Many of us get confused. There is simple pleural fluid will come from any place, but there is often a situation when fluid cannot be aspirated. So, if anatomy tells us why the pleural fluid looks a little high, falsely looks high in the lateral side, from where to aspirate, whether it is a organized pleural effusion or a fluid pleural effusion. So nowadays we have to do thoracoscopy in most of the cases. For in that situation, the anatomy is very, very important to know. So once again, thanking you. Dr. Chauhan rightly said that he is a bulldozer in our, another bulldozer is sitting on the chair as a chairperson.
Yes, sir. Sir, इधर.
Thank you, sir, for giving me an opportunity to speak on this topic. It's a privilege to be here when sir has taught me everything which I know currently, and to be here to be able to take this talk with sir sitting there is a pleasure in itself. So, thoracoscopy step by step. So, medication before you do the procedure itself, and during the procedure you need to monitor the cardiac rhythm, the blood pressure, the oxygen as well. So what are the skills which are required to do, which you need to know before you want to go ahead with a thoracoscopy? You should definitely know a diagnostic and a therapeutic thoracensis. You make a small bleb. This is just like putting in an ICD. So you make a good enough bleb, and then you keep on sucking and keep on giving the anesthesia. Then you just take in fluid where you can see the fluid has entered here. Then you infiltrate the remaining of the area. This is the other videos of the trocar insertion. The fluid is being aspirated now. As you can see, we are in the right space.
And we were supposed to hold one workstation, a live workstation on gentlemen's. So there was 3 cases lined up, one for him, one for a UK expert who was just a thoracoscopist. He used to not do any other procedure, but he was doing a thoracoscopies for say last 10-15 years. So when he did the procedure, he took almost 30 minutes, and Sandeep, when he took over, he finished the procedure in 10 minutes with the same level of accuracy and proficiency explaining. So that gentleman stared at me, and he asked, there was no need of me coming to India that day. So that was a nice experience.
Thank you.
Thank you, respected chairpersons, Dr. S.K. Katiyar sir, Dr. Sandeep Katiyar, Dr. Anurag Malhotra, and NCCP UP branch and IMA Kanpur. Thank you for inviting me for this extraordinary conference come CME on dedicated to medical thoracoscopy. It's really my privilege to be here at Kanpur, and I'll try to finish my talk in 15 minutes and give an overview of the role of medical thoracoscopy in pleural malignancies.
Excellent lecture. So, please tell me, if you find some bleeding points on the tumor, should you attempt biopsy or avoid? And which other situations you should avoid biopsy?
So biopsy, first thing is always take from the parietal pleura, don't touch the visceral pleura. We normally don't.
Bleeding points of the tumor.
Sorry.
तो हम अगले विषय की ओर बढ़ते हैं।